Detours. Brought to you by Sports and Spokes, the magazine for wheelchair sports and recreation. At 19 years old, I had a car accident and have been using a wheelchair for the better part of 5 decades. Early on, I learned that maintaining healthy skin and posture are two of the most important aspects of maintaining a quality life in a chair. For the past 10 years, Tamara Alexander has been my physical therapist at the Long Beach VA and has worked closely with me, giving me sound advice in choosing both new chairs and cushions. We sat down recently and she shared some of the techniques she uses to keep her patients healthy. So, if I were to come to you, because I've been extraordinarily lucky, I haven't had, the typical skin problems, which can be moderately devastating. I mean, skin can break down to the point where you're talking about surgery and perhaps months, if not a year, in the hospital to get healthy. So the first step for you is don't let the person break down.
Yeah.
And so there's a lot of things to work with. And you're dealing primarily with pressure mapping and cushions.
Right. And pressure mapping is, I would say, is necessary for any clinic. It's the visual tool that we need to teach our patients what is happening underneath their seating surface when they're just sitting, when they're resting, like, Bob, show me your resting posture.
Yeah.
It
ain't pretty.
It's not always like this, right? This is where we want to be. But
Right.
truthfully, when life happens, you're trying to get stable.
Oh, no. Yeah, no, I'm always
You're trying to do this. Right.
Yeah,
and then you're
I'm
going to sit for a while, so we have to, we basically use the pressure map. And it's largely for the patient to be aware of what's happening underneath. It's a great visual tool for teaching. I am adept at using my hands, feeling where the bony prominences are, where you have flesh, where you are absence of flesh. We use these anti-slip sheets in order to get underneath the patient's bottom so we can feel where those bones are and not put any pressure on their skin. We don't want to make skin problems for our patients. So this is a cool tool. It's an anti-shear, less friction material that we use to check out cushions and bottoms. But in the absence of that, I always go back to what God gave me. My hands are my best tools. But the visual tool has been a life changer. I think patients now understand a little bit more than they used to when they come to see me. So we use this initially. We use this upon reevaluation multiple times, in a patient's lifetime, over a year, whatever. And we have the ability to upload the pictures to the medical record so that we can document, this is your initial sitting. This is, 2 years later. This is 6 months later, whatever it is. So it's a neat tool.
Well, the education up front for somebody to know where am I heavy, where am I hot, where do I lean,
Right.
These are all things for them to look at so that you can also evaluate them for potentially what is the best possible cushion for them.
Right.
Are they super skin sensitive?
Right.
Is their skin very durable? Do they have a lot of curvature? So, I'm volunteering to use my sloppy 43-year-old chair posture here,
Yeah.
but we have a lot of things going on here, and I'd like to take a look at the skeleton if you could.
Yeah.
So
The old skeleton.
as you know, I'm basically thoracic 6.
Okay.
So
In general?
there. Okay, in general there. So over the course of my 40 plus years with rods in my back, you can see just how severe my curvature is. So I have 2 curvatures.
Yeah.
I have both what you would call a scoliosis and a kyphosis.
Right.
So I curve 2 different ways.
And you can see it.
Yes.
Now, the zipper is midline,
Yeah.
but you are not.
Right.
Right. There you go.
Which in turn means now when you were talking about the pubis area of the bottom
Right.
would mean that I sit particularly heavy on this particular issue.
On the right, yeah.
So
It's like the Leaning Tower of Pisa.
yeah,
Yeah.
and there's to a point there's only so much you can really combat.
Absolutely. Yep.
This is really about just keeping my butt healthy.
Yeah, and it's going to be you fidgeting throughout the day to, and keeping active and stuff. And that motion of pushing your wheelchair and getting through your day, that's pressure release.
Mm-hmm.
That's providing circulation to the area. This is a massaging effect, if you can say that. So I'm not usually worried about the manual wheelchair user unless they're not moving very much, which is a problem. And it could be a walking person that sits in the movie theater throughout the day. You know, if they go to a movie for 2 hours, 3 hours, they're sitting, but they're not sitting like this the whole time. Oh, not with those new lounge chairs, right? They're back like this, but they're constantly like adjusting their sitting posture because their butt gets sore.
Right.
Your butt is going to be sore. The problem is you can't feel that.
Right.
So I need to teach you like what your pressures are when you assume these different postures, and give you an idea of where that pressure is. And that's the beauty of the visual effect of the pressure map system.
So let's go ahead and take a look at it and see exactly what it is that I deal with in terms of where my heavy and hot spots are, and then address how it is that you would typically relate to me, how I'd want to take care of my skin.
Right. Okay.
So
you want to hop out?
I will do that. And we'll just kind of first take a look at exactly what I'm sitting on right now. And
do you want this at the level?
No, I think we're good.
Okay. And then, you know, like I always look at the patient, how they transfer. I know Bob, so I know how he transfers.
All right.
So this is Bob's cushion, and this is, if I took off the cover, you would see the Franken cushion that he's made.
Right.
Which is customized Bob's way. As I would say.
Yeah, that's friendly.
Yeah, okay. That's fair. So what we do is I usually just, scan the cushion, and I'm like, okay, what are we working with? And I just know this cushion is a J cushion, which is a hybrid cushion of dense foam on the bottom and different varieties of gel on the top.
Correct.
And it has a couple of straps to make sure that it stays in place.
All that.
Yeah. So
and some duct tape.
And some duct tape, yeah. So anyways, this can just hang down here.
All things that make you as a therapist horrified.
Well, sometimes, in your case, I'm not as horrified. It can happen. So what you want to do is place the map in so where that it's not hammocking. You want it to envelop all the different curvatures of the cushion. So sometimes I take this battery pack and I let this lie. So when you transfer on there, I'm gonna be able to get every surface. And the hammocking is gonna cause like this effect where if it's a visual thing, it'd be red hot underneath it if it's hammocking on you. Mm-hmm. So I want to make sure that you're gonna sit in there in your cushion the way you want.
Just pointing this out really quick. I mean, typically, if I came in here, you would probably really not want me in a sling back. You would typically want me in more of a custom back.
No, not necessarily. No, I mean, I encourage more lightweight features as you need it. Now, if you need postural support, then we might think about a solid back. But my practice is I like the lightweight features of a sling upholstery on the bottom, and a general cushion. If you have a lightweight wheelchair, you add a solid back, you're now pushing more weight.
I'm making a lightweight wheelchair not light.
Right, exactly.
All right, so next step, I hop on before you hook up?
Yeah.
Okay.
Yeah, that's
Let's give it a little angle, and okay. I assume you want me on there as clean as possible?
Yep. So wait, one second. You need to make sure it's not. Yep, go ahead. There you go, and readjust as you need. There you go. Good. Okay. Yep, I think we're fairly even, and we'll check that when we hook in here. So this is a Bluetooth system, and that's the battery pack. And then this is a program that is the Body Track Pro. So right now, this is the front of Bob's cushion. That's where the tail's coming out, where the battery pack is. So I can reposition it so where it's facing you. So these are your legs. So you have high pressure is red, which is 200 millimeters of mercury on the outer parts of your distal thighs. So right here is my guess. And now this is where I use this anti-shear thing to verify these things. So in the critical areas, you can kind of see where his ischiums come into place, right? Right heavy and almost center. That's where your curvature is. You're like a little bit to the center.
Point to that on the skeleton.
So this is what is lighting up in these two portions now. You can move this little box here. So that's where it's the heaviest is on the right ischium for him. This is just like how Bob's sitting right now. Or here, actually, and he's sitting more heavy on the right side. And then you can see that it's almost even. I don't know if you just subconsciously just changed you breathed a little different or something, because as soon as you settle in, you know, and this is the beauty of your level of injury, Bob, you're able to shift your weight. You can be fidgety. You can change this. This is not going to stay right here. It can go here. It can go here. It can go back and go forward. You know, you can change it all along this area, and all this area has gel, you know. So this area right here is where you have flesh. This is not, you know, one bony part just sticking straight down like your two ischial tuberosities here. We're talking a long bone, which is your femur, and that's distributed along the edge of your cushion in the front. Okay, so now that's hot right there because you just now settle into that one spot, but you can change that anytime. So for instance, go ahead and push up and reposition your hips a little bit. Look at that pressure release. And you're hardly ever, you're not even pushing up all the way. You know, long are the days that you know, people push up, release, and you're like, hold it for 3, you know, nobody can do that really. It's like an iron cross. But if you just shift your weight left to right, reach down for one way for a minute or two, and then the other way, that's a pressure release. You lean forward on your elbows, that's a pressure release. You lean back, that's a pressure release. It's distributing the, you know, basically the circulation around your seated area that's very critical.
In keeping with, you know, adjusting my cushion as much as I do, I've created wedges on the side to keep, you know, otherwise my legs would tend to flop out.
Exactly.
You know, and this is one of those cases with a manual chair user like me, with a very active life. If my legs are, if one leg is here and one leg is there, I can't carry a bag of groceries. I can't get my laptop from point A to point B. So I've done a lot of adjusting for me, and I know that those hot spots typically aren't great, but you know, I try to keep a diligent eye on that skin, and you know, which is not a guarantee, but still nonetheless.
And they always say, like, if you keep your skin intact, I mean, you're basically 100% more skin protective than if you have any kind of injury to it. So once you break down that skin, as we age, I mean, our skin gets thinner. You know, and that's just part of the aging process. So that means that skin is no longer as thick as it was, and so that's when you're more apt to have skin breakdown. You know, along with the atrophy of the muscle.
Do you find that some people are just more genetically predisposed to break down for, I mean, not for any, who knows, why does one person end up with multiple cavities and another person doesn't? I mean, are some people just skin unlucky?
You know, I don't think so. I think that education, early education, is really key to keeping the skin as intact as possible. Diligent work by the caregiver and the patient to be diligent to check the skin every day, use a skin inspection mirror, use a caregiver's eye. We now have the habit camera that, you know, basically is like a selfie stick that has your cell phone, and you can literally take pictures serially over a course of a day to make sure your skin is intact as it was, you know, so that they could be diligent at their skin as well. So as long as you keep that, you know, at the forefront of your mind, like, keep my skin like patent as all possible, you know, that's the best form of education that one can receive at the beginning of your injury. Once that breaks down, you're more apt to break down even further because that skin is no longer as resilient as it was, even older skin. You know, so, you know, early education, pressure map system for visualization of what's going on when they're sitting, when they're reclining, how far do they have to tilt back in a power wheelchair in order to get that offloading effect, or what you did to lift up to then clear this red area and make it all white and blue, which is your lowest form of pressures. I mean, is very key. Okay, so
would you be typically horrified by what you see there?
No, I know that this is tissue tolerant areas in your body, because that's where your legs are. The areas of my concern are these two little bullet points right here, and I know those are your issues without even feeling where it is. Like, you can just see that's your sacrum, and those are your ischions. I can guarantee you that.
So that's my when you say sacrum, my tailbone.
Your tailbone.
That's literally how crooked I am.
That's where your tailbone lies in relative to your right ish and your left ish. So you can switch around and kind of feel out where that is, because you can obviously maybe get into that sacral relief.
I mean, even trying as much as I can in this cushion, I can't make myself center.
Right. So the beauty of those offloading cushions or those custom cushions, right, Bob, is that typically all these areas that have all this highlighted pressure are offloaded because other tissues are taking up, you know, the bulk of that, and they're letting those bones lie in the recesses of a cushion well. And that's the theory of that cushion.
I know it's pretty sensitive topic to talk about, but it's it's pretty well known in the spinal cord injury world that there's a certain amount of incontinence, and I think that cleanliness is a huge key, and that's one of the things that I've always focused on in my life. Urine, sweat, feces, all those things are not good things for the skin.
No, I mean, your skin is your largest organ. It's also the barrier to critters being out, but you also have critters that are on there too. There's thousands of bacteria that lie on our skin that help us keep us kind of safer. But sometimes there's little buggers that are not good for our skin or not good for the inside of our bodies. But you have a break in that skin, you're liable to get an infection because there's an avenue into your body. So, keeping that area dry, you want a balance of moisture and dryness. You want a little bit of moisture because you don't want it to be so dry that then it cracks open because there's an opening of your skin. So you have to have a balance of that. But incontinence or continence is also a very key thing for a spinal cord injury to pay attention to, anybody in a wheelchair, because you have a leak in your condom cath or your indwelling catheter, or too full of a bladder that you didn't relieve yourself, and then it starts to leak. That's going to get into your skin, and you don't feel that per se, or maybe you smell it if you're lucky, right? And that can give you an idea to just get out of your chair and check to see what's going on and feel with your hands, because you can feel if you're wet. So making sure that you use all of your senses in order to evaluate what you're doing.
In accordance with you giving me the right cushion beyond pressure relief, you have to take the person into account too. For me, I get in and out of my car 3, 4, 5 times a day. I grocery shop, I water, I bend over, I pick up. There are other people who maybe, for whatever reason, they're a little bit more fixed. So you can put somebody into a fixed cushion where, there's ultimately their focus of the day is pressure relief. They do not want to risk skin breakdown, which I don't either, but still I have a certain activity level. So you need to find a way as the therapist to find that hybrid way to, make it fit not only my health, but my day.
Yeah. It's all about function when it comes down to it. So we have certain levels of, cushion properties. I call them cushion properties because they're different materials. So you have foam, you have air. Right? And then
this is the Rojo.
This is the Rojo hybrid, and there's some foam in the front here. So, the idea is to inflate the cushion with a pump using this valve, and then you basically have these areas like where Bob's sitting. These areas are, basically accommodating all of the bony prominences of the behind, the bottom, and it's sitting and it's giving some cush to that, giving some lift to that. So that's going to take up any of the pressures that they're sitting on. So if you can imagine the backrest being, maybe a solid backrest or something, that's providing some postural support so that they stay upright. If the backrest is too lax, right, and they're like this, they're sitting squarely on their tailbone, right? And then they're pushing those ischiums to the front of the cushion well, which is a lot harder. So that's where you can get some breakdown. So, the backrest and the cushion are a system that we work together in as far as determining what the seating system should be for a patient. They work one and the same. You want both of them to be, complementary to each other.
Right. So if somebody came to you and they had skin sensitivity problems, and you recognize that right off the top, is this the direction you would tend to go first?
It would be one of the ones, and I always say, like, what kind of support do they have? This requires quite a bit of dexterity to open up this valve, to put the rubber tip on there and make sure that you have the strength to pump the air into there. And if you don't, then you have to have the person there to teach them how to do it, or teach the veteran how to direct their care independently, which is another important part. So we give them a pump for every cushion, like the Rojo Hybrid Elite here. But if they have good caregiver support and they don't have maybe good sensation, they can be very successful in this type of a cushion. And this is awesome because you have the ability to be a little bit stable with a little bit of offloading.
So just for the sake of it, we're seeing where my hot spots are. How about I hop on this and we take a look and see what the difference is?
Yeah. And it's about the same size of your cushion. It might be a little wider.
Okay.
This is a 15.75, and I think yours is a 15, I think. Okay, so let me just I can grab this for the sake of ease, and that's going to shut that thing off for now. It's going to freeze it in time. Okay. A fairly advanced transfer for somebody.
For an old guy.
I said for somebody. I didn't say old guy.
I mean, it's really quite amazing, really, when you look at it. You can see that even in the sling, you can see where I'm heavy.
Yeah. Right there is like a big divot. Now, this cushion fits because you don't have any side guards, no armrests, no nothing. But, you know, it's still quite large for you, but it'll still work. And again, we're going to make sure we're not tethering or, you know, hammocking the mat. Okay, go ahead.
Ready?
Yep, ready. Good. Get this plugged back in. There's okay. That loose. Yeah, it's not good. Let's get it connected. Good. Go back in. And there you are. So, looks a little different.
Yeah.
Yeah.
So green and blue are ultimately a whole lot better than red.
Right. Have you tried this cushion before, Bob?
I have.
We're going to do this evaluation today.
All right.
So, you know, I mean, if you look at the...
It's not bad. I mean, one of the things I've always rebelled against the Roho on is just in general, it's been the floppy leg syndrome.
Right.
I mean, typically the way I always remembered the old Roho cushion was that it was Roho all the way to the front. So it didn't fit into my lifestyle as an active person. But I like that color a lot better.
Yeah. And you know, that's the reason why they came out with the different materials in a Roho. It still has the Roho properties. What they pride themselves on, what they've had the 50-year history of providing, is the air cells, which is, you know, in theory, offloading and accommodative to people's skin health, right? But they provided a little bit of stability with the denser foam on the bottom, but then they still give a little bit of cushion in the front. And you have the ability to adjust that height, you know, to the seating height that the patient needs as well. As long as they're offloaded, and we teach the patient how, you know, the caregiver of the patient, how to check where their sitting bones are. You can see where your sitting bones are. And we teach them how to look for that. So I always follow the femur all the way that leads to the ish. There's always a straight line, no matter where you're sitting. So I teach them how to search for that and how to evaluate, like, is there enough underneath their ischiums? And it's always 1 inch for the Roho. You know, they teach 1 inch offloading, so you're not sitting on the seat pan at the bottom of the cushion.
If you had to anticipate before I even do it, jumping onto one of these other cushions, will you expect either one of the other two cushions to provide me with a better result than what you're seeing here?
I think that this one would be probably better than the bottom one.
You want to take a look at it?
Sure, why not?
We'd like to take a minute to thank our sponsor, Sports and Spokes magazine. For nearly 50 years, they've produced stories on iconic athletes performing at the top of their game, given generational coverage of sports dating back to the 1970s, and they've shown the way with exciting and timeless magazine cover shots. To stay on top of all the latest news from the world of high-performance adaptive sports, go to sportsandspokes.com. Sports and Spokes, the magazine for wheelchair sports and recreation.
All right, Tamara, so ultimately, I mean, the disaster of disasters is the skin breakdown.
Right.
For many paraplegics, quadriplegic, spinal cord injury. And we discussed the three, primary areas. We've got what you call the ischium, and you refer to the tailbone as the sacrum.
Right.
Okay, so this is actually literally the bottom of the spine.
Right, right.
So where do you see the most breakdowns, ish or tailbone?
Ish. And the reason being is because the cushion is not supportive enough. Like, maybe it was evaluated, and at the time, like, we did today, you know, like, oh, that looks a lot better. Let's just try this. It's the complacency of not being diligent at checking your skin and checking to see that your air is in the cushion. So that's one of the things, is that it requires maintenance. It requires a diligent mind to say, do I have enough air in my cushion for my daily, you know, needs? Will I take this in my backpack so I have it to, you know, to put air in there? You know, if I'm at Disneyland, I'm halfway through, you know, you might need more air, or, you know, so you have to be very adamant that they know that education, that, you know, this requires maintenance. It's not going to always have air. You go from here to Vegas and you're going to drop an elevation, you're going to need to check to see that the air is still there, because sometimes that causes the leak out of the valve is the change in elevation. So if you go up into the mountains, you need to check to see that it's not overinflated. When you come down from the mountain, you can't, you know, you're going to expect that it's going to lose some air. So just know that you have to check the air again.
So we talked about cleanliness and a lot of other things and pressure relief, but one of the things that we didn't discuss right off the top was upon injury, or when somebody, you know, sustains a spinal cord injury or disability, the first thing that happens is what's known as atrophy. So you lose, I mean, all this down here, you've got muscle, you've got padding, you've got the necessary fat, skin, and health back there. That's why, you know, when you're sitting, you know when you're hurting. So atrophy starts. That's the critical moment where you need to be educated to know, I have to start looking at my skin.
Oh, absolutely. And this happens in our world. Acute training and acute rehab involves skin training as well. Health. How do you keep your skin healthy? And we have all these series of Yes You Can teachings, you know, every week, that we have different topics. And one of it is skin health, skin integrity. It's such a vital portion that can derail somebody's day. You know, if you're, you know, employed, like we have, you know, our old PVA rep up there from National, he basically now has been 3-4 months post just trying to heal and get back to where he was before. He still has a job. He has to do it now, you know, seated in a power wheelchair or on his back, because he can't sit for very long. You know, so that really derails people's day and, you know, overall health picture. Because they're going to now have to pay close attention. So
for the rest of their lives.
For the rest of their lives. So education is tantamount to be said in the beginning of an injury.
So let's talk about this surgery. So let's tilt back out.
Sure.
So it's you know, I've heard this terminology and it's sort of intriguing to me. So the very first thing, you come in and there's what they call the decubitus ulcer.
Right.
And it can be many different stages, from, you know, just really, I mean, not to be horrific, but an open gaping wound that's just not going to heal without getting that dead tissue out of there.
Absolutely.
So the doctors go in, they remove that dead tissue, and then they do what's called a scrape.
Sometimes they remodel the bone. They take a little bit of the bone, they shave the bone so that, you know, typical bones, every bone has a ligament or a tendon attached to it, basically reshapes and remodels throughout your lifetime. So it's not uncommon this is where your hamstrings attached to. So if you imagine your hamstrings are attached to, you know, your calf muscle, right? So as we flex and bend, it's constantly tugging on the bone. And when you're sitting in a wheelchair, sometimes it tugs so much that it doesn't replace it as fast, because your body's not as efficient as it used to be. So you have these divots in your bone. So that can cause internal wounding.
I mean, literally to the point where infection can get into the bone.
I mean, as a person who's very adept with my finger and like what I'm palpating, I can feel the rigidity of that, you know, breakdown of the bone. So that can cause the internal wounding just from being, you know, the nature of spinal cord injury and how, you know, our bodies are reacting to increased spasms and stuff in the chair. So that is something that they pay attention to. When they see something like that, they automatically just shave the bone down, in addition to flap repair.
So that's literally step one. Then it's out of surgery, get the tissue healthy, get things closed up. Right. Stage two, the repair or the cosmetic portion.
Right. So they basically do all of the you know,
which is called a flap.
Right. So they basically literally take like a, you know, like a musculocutaneous flap, and they just cover the hole. So you have this big gaping wound here, right? They take apart, you know, your gluteal muscles and your hamstrings, and they flap it over that hole, and then they sew it up. I mean, they rearrange your muscles in lieu of that tissue that was lost from the necrotic things that were going on before that.
You know, and what
it's
makes
beautiful, actually, after a while.
What makes it, you know, just so critical is that you're not just, you think, oh, you got a boo-boo on your butt. You know, I mean, you have actual infected tissue that gives you fevers and makes you sick.
Right, absolutely. I mean, it is definitely just a gaping wound like any other wound, but unfortunately, that's also where you defecate, right? So it has the ability to get really infected, and it really can, and it can cause a lot of, you know, havoc in your bladder and your bowels when that is just in that same area. I mean, you have to stay ahead of it, and that's the challenge, is staying one step ahead of infection all the time. But, you know, so the flap surgery happens, they sew it up, and it's nice and pretty. It's got, like, you know, a new stitch pattern there. So they basically take at least 3 weeks to let that heal and all the sutures to actually take. They take out, like, anything that hasn't really fallen out already. They take out all the stitching, and then they remove the drains. And then they do a period of flap lying, they call it, and that's where they just basically take all the pressure, and it starts to build resilience in the skin. You know,
and this is where the evolution comes back in for you.
Yeah.
Now maybe the person you're talking about, who I know is up on the ward, maybe at this point now the chair that he was in when he got that sore is no longer relevant, or really not that usable to him. He has a whole new set. He needs a different type of chair, with a different type of positioning, with a different type of cushion. It's complex.
It is. And so we kind of prepared for that. And I basically said to him at this time, I said, so you have a very custom chair. And I know, like, off the bat, right after the 3 weeks or 4 weeks or 5 weeks, whenever you're allowed to sit, that's not going to suffice for you for now. I need to get you into something general so that you can get stronger, because he has to transfer to and from bed, to and from shower chair, to and from toilet, to and from car, right? Yep. So all those things need to be retrained. Are you able to do those things again? You know, it's a lot of transfer training. So after that, you know, we're now starting the process of actually getting him back into his previous system, but paying attention to, like, how are you sitting now? And it just so happens that he didn't get the wound because of his seating, his chair, his cushion. He got it from his shower chair.
You see, and this is where, once he leaves here and he's got the proper chair, he's healed, he's got the proper chair, he has a proper cushion, now he's going across the way to Janice to start talking about commode chair, shower chair, daily living.
Right. Toilet,
Toileting.
Yep, everything. So, I mean, that's the reason why the rehab team approach is so wonderful. You have to have all these lenses in order to see where the patient goes in every part of their life. I mean, that's what living is. You know, you have to do the things that you have to do, and this person has all those things at home, so that we have to recheck everything again, you know. So, you know, it's a whole process, and it's wonderful that we have this in place so that we can then reintroduce them back into the, you know, the world of upright and back in the chair.